Every single day, people walk into my practice convinced they're doing everything right. They've committed 30 minutes, 5 days a week, rain or shine, and they're genuinely proud of that. They should be. But they're sitting across from me with knee pain that won't quit, a fatigue that no amount of sleep touches, numbness creeping down their calves, and a growing, sinking suspicion that their body is just giving up on them. The first question I ask is always the same. Tell me exactly how you walk. And that's where everything unravels. Because the problem is almost never that people walk too little. The problem is that they walk wrong. And wrong walking isn't just wasted effort. Over time, it puts real, measurable stress on your joints, wrecks your posture, overloads your heart and blood vessels, and drives low-grade inflammation through your tissues. There are 7 specific mistakes that I see over and over again. 7 ways your daily walk could be working against you instead of for you. Stay with me because by the end of this, you're going to walk differently. Before we get into it, do me a favor. Subscribe right here to the Dr. Weston channel and hit that like button. It takes 5 seconds and it genuinely matters. We're building toward 10,000 subscribers, people who actually want to understand what their body is doing and why. Because here's the thing, your primary care doctor has 2,000 patients and 7-minute appointments. Your specialist is booked out for months. Nobody is sitting down with you to walk through this. That's exactly what this channel exists for. I'm Dr. Weston, and for 15 years, I've watched the same mistakes play out in clinic after clinic, patient after patient. The insurance companies profit when you keep coming back. The system is built around treatment, not prevention. So let's change that right here. Let me start with something you need to understand before we get to the mistakes, because without this context, none of the rest of it will stick. Why is walking after 50 not just a nice habit, but an actual medical necessity? Because after 50, your body launches a series of physiological changes that are predictable, measurable, and completely non-negotiable. Change 1. You start losing muscle. Not all at once, not dramatically, quietly, steadily. The medical term is sarcopenia, the gradual, age-related loss of muscle tissue. After 50, you lose roughly 1 to 2% of your total muscle mass every single year. That sounds manageable on paper, but over 10 years, that's a loss of 15 to 20% of your total muscle. And muscle is not just about lifting things. Muscle stabilizes your knees and hips when you walk. Muscle regulates your blood sugar, the glucose circulating in your bloodstream right now. Muscle holds your spine upright. Muscle catches you when you stumble. Lose enough of it, and everything downstream starts to fail. Change 2. Your joints get stiff. The cartilage at the ends of your bones, the smooth, cushioning tissue that lets your knee glide instead of grind, has no blood supply of its own. Zero. It gets its nutrition exclusively through movement. When you load a joint and move it, synovial fluid, the lubricating fluid inside the joint, gets pushed into the cartilage and delivers the nutrients it needs to stay healthy. Stop moving regularly, and that cartilage begins to starve. It thins out, loses its elasticity, and over years, it begins to break down. That breakdown is what we call osteoarthritis. It is not inevitable, but poor movement habits will absolutely accelerate it. Change 3. Your metabolism slows. Your basal metabolic rate, the number of calories your body burns just to keep itself running at rest, drops by roughly 2 to 3% every 10 years after 50, which means the exact same lifestyle that kept your weight stable at 30 will cause you to gain weight at 55. Not because you changed anything, because your body changed. Change 4. Circulation gets less efficient. Your blood vessel walls gradually lose their elasticity. Your heart pumps with slightly less force. Blood flow to the legs, the feet, the small peripheral vessels, it deteriorates. This is exactly why so many people over 50 notice their feet are always cold, why they wake up at 2 in the morning with a leg cramp, and why by late afternoon their lower legs feel like they're filled with wet sand. Here's what's remarkable. Walking, done correctly, addresses all 4 of these changes simultaneously. It activates muscle. It drives cartilage nutrition through joint movement. It accelerates metabolism. It improves circulation. Multiple studies confirm that people who walk regularly have significantly lower rates of cardiovascular disease, type 2 diabetes, osteoporosis, and cognitive decline. But, and this is the part nobody ever tells you, that's only true when you walk correctly. Walk the wrong way and you don't get a smaller benefit. You create new problems on top of the existing ones. Let's go through every mistake one by one. Mistake number one, you start your walk too fast. This is the single most common mistake I see across every age group, every fitness level. People step outside and immediately hit full pace. Seems logical. Why ease in when you could just get moving? Your body is not a car. You can't turn the key and have everything running at full capacity in 60 seconds. There's a transition that has to happen, and skipping it has consequences. Here's what's actually happening in those first few minutes. First, your muscles are cold. Cold muscle fibers are less elastic, and less elasticity means higher risk of micro tears, tiny, microscopic rips in the muscle tissue that don't cause symptoms on their own, but accumulate over months and eventually produce chronic pain syndromes. Second, your joints are not yet lubricated. That synovial fluid pools during rest. It needs several minutes of slow, gradual movement to spread evenly across the joint surface and form a protective film between the cartilage. Start fast and your cartilage is running dry from step one. Third, your cardiovascular system hasn't had time to adapt. When intensity ramps up too quickly, heart rate spikes and blood pressure jumps harder than it needs to. After 50, when your vessels are already less elastic, that sudden surge puts unnecessary stress on the vessel walls. The fix costs you zero extra time. For the first 3 to 5 minutes of every single walk, move slowly, leisurely slowly, almost uncomfortably slowly. That is your warm-up. Not for athletes, for every person who wants to walk without building up damage they won't feel for another 6 months. After 5 minutes of slow walking, your joints are lubricated, your muscles are warm, your heart has settled into a working rhythm. Now pick up the pace. Mistake number 2, wrong posture while you walk. Go outside and watch people walking on any American sidewalk. Most of them are hunched forward, head jutting out in front, shoulders curled inward, eyes aimed at the pavement 3 feet ahead. It looks like everyone's walking against a wind that doesn't exist. This is not just unattractive. It is a biomechanical problem that runs from your neck all the way down to your knees. Here are the mechanics. An adult human head weighs about 11 pounds. When it sits directly over the spine in neutral position, your neck muscles carry exactly that, 11 pounds. But when the head drifts forward by just 1 to 1.5 inches, the load on the cervical spine, the neck portion of your backbone, increases by roughly 3 times. At 2 inches of forward shift, it multiplies to 4 or 5 times. That means instead of carrying 11 pounds, your neck and upper back muscles are now holding 45 to 55 pounds, continuously, for your entire walk. Walk like that for 20 or 30 minutes, and you're not building resilience, you're generating chronic tension in the neck, the shoulders, and the base of the skull. This is why people come home from a 30-minute walk with a headache or a stiff neck. It is not a draft. It is not getting older. It is posture. The second hit lands on your breathing. When your chest is compressed and your shoulders are curled forward, your diaphragm, the dome-shaped primary breathing muscle that sits just below your lungs, cannot fully descend. Your lungs cannot fully expand. So you breathe shallow, pulling air only into the upper portion of your chest. Your muscles and your brain receive less oxygen than they need. You walk for 30 minutes and feel like you walked for an hour. People blame their age or their fitness level. The real culprit is one correctable mechanical error. There's a third consequence almost nobody connects. Bad posture disrupts the entire movement chain. Head forward, the lower back compensates with an exaggerated arch. The pelvis tilts, and the knees begin operating at the wrong angle. Joint load increases, not because you're aging, but because of posture. How to fix it? Picture a thin thread attached to the crown of your head, pulling you gently upward. Not a rigid military stance, just allowing your spine to decompress. Shoulders relaxed, drawn gently back. Eyes forward on the horizon, not at the ground. Chin parallel to the pavement, chest open. In this position, your lungs work at full capacity, your neck carries no excess load, and your spine distributes your body weight the way it was designed to. I want to tell you about Linda, because Linda is why I made this video. Linda is 58 years old, a registered nurse from just outside Atlanta. She'd been walking 30 minutes every morning for 2 years, committed, consistent, genuinely proud of the habit. She came to see me because her right knee was developing a deep, persistent ache that made her dread her morning walks, and she'd been getting tension headaches 3 or 4 times a week. She'd been to her primary care doctor, who told her the knee was just wear and tear for her age. She was starting to accept that. When I watched her walk, I could see the problem in 30 seconds. Her head was nearly 2 inches forward of neutral. Years of leaning over patients in hospital beds had locked that position in. Her shoulders were rounded, her arms barely moved, and she was wearing running shoes she'd bought 2.5 years ago, the soles worn down unevenly at the outside edge. We corrected her posture. We addressed her arm mechanics. We replaced the shoes. We added 5 minutes of calf and hamstring stretching after every walk. In 4 weeks, her headaches dropped from 4 a week to 1. The knee pain was mostly gone. She called it a cheat code for her body. It wasn't a cheat code. She just stopped working against her own mechanics. What Linda had, millions of Americans are dealing with right now, and most of them will be told it's just aging. Mistake number 3, the wrong shoes. Pay attention here because this is the part most people overlook entirely, and it's one of the highest impact, lowest cost changes you can make. For your joints, there is nothing more important than what sits between your foot and the ground. 2 age-related changes make footwear critically important. First, the fat pads on the soles of your feet thin out with age. Those pads were natural shock absorbers, softening the impact of your heel striking the ground with every step. By your 50s and 60s, that natural cushioning is significantly reduced. Your shoes have to compensate. If they don't, every ground impact travels straight up the chain, ankle, knee, hip, lower back, step after step. Second, the muscles and ligaments of the foot weaken over time. The arch can begin to collapse, a condition called acquired flat foot. When the arch collapses, the entire load angle on your knee shifts, the axis of your hip joint changes, and spinal stress increases. Good arch support can meaningfully slow that process. What you need in a walking shoe: cushioning in both the heel and the forefoot. Soft enough to absorb impact, but with enough structure that your foot doesn't sink without support. Arch support, not a rigid insert, but a sole shape that follows the natural contour of your foot, and a flexible sole at the front, at the ball of the foot. When you walk, your foot needs to bend there. A completely rigid sole disrupts the natural heel-to-toe roll and overloads the calf and the Achilles tendon, that large cord at the back of your ankle. One more thing about shoes: wear. Many people are walking in sneakers they bought 2 or 3 years ago. The outside looks perfectly fine, but the cushioning in the midsole, the layer between the outer rubber and the inner lining, loses its shock-absorbing properties long before the shoe looks worn out. If you walk regularly, replace your walking shoes approximately once a year. This is not a pitch. This is osteoarthritis prevention. Quick question for you right now, and I genuinely want to know: how old are you? Drop your age in the comments below. Everything I've covered so far, and everything I'm about to tell you, lands differently depending on where you are in this process. After 50, the margin for error shrinks significantly. The same habits your body forgave at 30 without blinking will produce real, persistent symptoms at 55. Drop your age in the comments. I want to see who's watching. Mistake number 4. You walk rarely, but go long when you do. This is an extremely common pattern. Busy week, no time, so on Saturday morning you put in an hour and a half, feel virtuous, and consider your fitness needs handled. From a physiology standpoint, this approach is fundamentally backwards. Your body doesn't respond to isolated bursts of activity. It responds to repeated, consistent signals. Every time you walk, your body receives a message. Movement is the norm here. In response to that message, your heart gradually becomes more efficient, your blood vessels adapt, your muscles strengthen, your metabolism stays active. This is called training adaptation, and it only occurs with repeated, regular stimulation. One walk a week is too weak a signal. The body never fully adapts. The benefit stays minimal. Worse, a single long walk after days of complete rest is a genuine stress event for muscles that are cold and unadapted. The next day, they hurt. People draw the wrong conclusion. Walking isn't for me, my joints can't take it. That conclusion is almost always wrong. The joints are usually fine. The loading pattern is wrong. The research is clear on this. 20 to 30 minutes of walking on most days of the week is the minimum effective dose for your cardiovascular system. That's the regimen that reduces your risk of heart attack, stroke, and type 2 diabetes. Not one long weekend walk, but 5 to 6 shorter walks per week. If you currently walk once a week, start with 3 times. Not necessarily 20 minutes, start with 10. After 2 weeks, add 5 minutes. Gradual isn't weakness. Gradual is what actually sticks. Mistake number 5. Your arms aren't moving. Most people walk with their arms either stiff at their sides, dangling loosely, or stuffed in their pockets. It feels comfortable. In reality, it strips away a significant portion of walking's benefits and disrupts the movement pattern your body was designed around. Here's why. Walking is a whole body cross-pattern movement. When your left leg swings forward, your right arm swings forward with it, and vice versa. This cross-coordination is hardwired into your nervous system. It distributes load across your spine symmetrically and reduces the rotational force on your trunk with every step. When your arms stay still, your lower back has to compensate for that asymmetry by over-rotating with each stride. For anyone who already has lower back issues, and that's a very significant portion of Americans over 50, this can directly trigger pain. Second point, arm swing recruits the muscles of the shoulders, chest, and upper back. More active muscle means higher caloric expenditure, better circulation, a more active metabolism. The same distance walked with proper arm swing delivers a meaningfully stronger physiological effect than the same distance walked with arms pinned at your sides. Third, arm movement sets rhythm and improves coordination, which becomes increasingly important after 50 when coordination gradually declines. A steady, rhythmic arm swing helps maintain a consistent stride and reduces the risk of losing your balance. How to do it? Bend your elbows to roughly 90 degrees. Let them swing forward and back in natural rhythm, opposite to your leg movement. You don't need the exaggerated pump of a competitive race walker. Just stop keeping your arms locked to your body. After a few walks, you'll feel the difference. The whole movement becomes easier and more rhythmic almost immediately. Mistake number 6, walking with your phone in your hand. 20 years ago, this mistake didn't exist. Today, it's one of the most widespread things I see on every sidewalk, in every park, in every parking lot. People are walking and reading texts, scrolling a feed, watching a clip, and they genuinely believe they're taking care of their health. They're not. Start with posture. When you look at a screen held in front of you, or worse, down by your waist, your head tilts downward. We already covered what that does. The load on your neck muscles triples or quadruples. Your shoulders roll forward, your chest compresses, breathing goes shallow. Every mechanical problem we talked about with bad posture is now actively reinforced and intensified because a phone screen pulls your head even lower than ordinary slouching would. Now consider safety. This is the most important clinical point in the whole video. After 50, the vestibular system, the balance and spatial orientation system in your inner ear, operates with slightly less precision. Your proprioception, your body's sense of where it is in space, gradually fades. This is a normal part of aging. What it means is that your brain increasingly depends on visual input to maintain balance while you walk. When your eyes are on a screen instead of the path ahead, you stop seeing the uneven curb, the crack in the sidewalk, the wet patch left by a neighbor's sprinkler, the step down off the curb. The risk of a fall rises substantially. A fall after 50 is not the same as a fall at 25. It frequently means a fractured wrist, fractured ribs, or, most seriously, a hip fracture. A hip fracture in someone over 60 means surgery, extended immobilization, and a rehabilitation stretch that can run for months. The fix is as simple as it gets. Phone goes in your pocket. If you want audio, a podcast, music, use earbuds. Keep the screen away from your hands. And one more reason. Walking while actually paying attention to your surroundings, your breathing, the sensation in your legs and your feet, that is documented neurological training. It exercises attention, coordination, and spatial awareness in ways that show up in the research. When your eyes are on a screen, your legs are moving, but your brain is somewhere else entirely. Let a walk be a walk. Mistake number 7, skipping recovery. Nobody talks about this. Not in most clinics, not in most conversations about fitness. The general assumption is that walking is such a gentle activity that no recovery is required. That assumption is wrong. Start with water. Muscle tissue is 70 to 75% water. Every biochemical process in muscle, contraction, relaxation, repair after exertion, happens in an aqueous environment. Even mild dehydration, just a 1 to 2% drop in your body's fluid stores, measurably reduces muscle elasticity, slows recovery, and increases the risk of cramping. After a walk, drink a glass of water. That's not a commercial for a sports drink. That's basic physiology. Now, stretching. During a walk, your muscles work in a shortening mode. They contract repeatedly. Without stretching afterward, they remain slightly shortened once you stop. Over weeks, this accumulates. Muscles get progressively tighter and more rigid. Joint range of motion decreases. A persistent stiffness sets in that people mistake for aging, most pronounced in the calves, the back of the thighs, and the lower back. 5 minutes of gentle stretching after every walk prevents this entirely. 5 minutes is what stands between you and that creeping stiffness that your doctor will call normal for your age. And rest days. Many people reason, if walking is good, more must be better. That's not how adaptation works. Your body does not adapt during exercise. It adapts during recovery. During rest, muscle fibers reinforce themselves, cartilage remodels in response to the load it's been given, and the cardiovascular system restructures to handle the new demand. Without adequate rest, adaptation doesn't fully occur. 1 to 2 rest days per week is not laziness. It is the correct protocol. Think of your walk not as an isolated exercise, but as part of a system. Movement, water, stretching, rest. Only as a complete system does it produce the durable, long-term results you're actually after. Here is your practical takeaway, 7 steps, starting right now. First, adopt the slow start rule. The first 3 to 5 minutes of every single walk, slow pace only, no exceptions. This costs you 0 additional time. You are simply starting slower. Second, check your posture right now. Stand up. Gently lengthen your spine, draw your head upward and back to neutral. Ease your shoulders slightly back. Hold that. Memorize that feeling. Reproduce it every time you walk out the door. Third, pick up your walking shoes and look at the soles. If they're unevenly worn, or you've been in them for more than a year of regular walking, replace them. This is one of the simplest, highest return investments you can make in your joint health. Fourth, end the one long walk a week habit. The target is 20 to 30 minutes, 5 to 6 days a week. If that's too much right now, start with 3 days. Add 1 day every 2 weeks. Fifth, let your arms move. Bend your elbows, relax your shoulders, and let them swing in natural rhythm with your stride. Take them out of your pockets. Sixth, phone stays in your pocket for the entire walk. Earbuds for audio. Screen away from your hands. 7th, after every walk, a glass of water and 5 minutes of stretching. That is all that stands between you and chronic muscle stiffness. How old are you, and what state are you watching from? Drop it in the comments. I want to see where you're all tuning in from California to Florida, from Texas to New York, from the Midwest all the way to the coast. The system profits from treatment, not from prevention. That is exactly why this channel exists. Subscribe to the Dr. Weston channel and hit that like. We're building toward 10,000 subscribers. One person who actually understands their own body at a time. I'm Dr. Weston.